thank Dr. Barsoom for hosting us. We have been working with the Cleveland Clinic throughout this, and we've really appreciated the advice, the counsel, and then the insight of what's going on the ground. So I've been able to talk with Dr. Barsoom throughout this, and I think they're doing a really, really good job. I want to give them in a minute a chance to talk about some of the things that they're doing. If you look at how patients who've come through here have fared compared to other places, I think that they have a really good record in terms of patients being discharged and patients recovering at higher rates than what you see elsewhere. And I think that that's because they're doing so much good stuff. An update on our situation here in Florida. We are now have tested 320,000 people in the state of Florida. As many of you know, there was not very much testing going on anywhere in the country just 2 months ago. So we've been able to ramp up a lot. Cleveland Clinic's doing a great job with different things. We, of course, the state and the National Guard have supported sites such as the one in Broward County that's been very, very successful. If you look, the last 2 days we've reported close to 37,000 test results. We've had under 2,000 positives out of that, and so in terms of new cases, because there are people that test positive when they're in isolation, they need 2 negatives to get out, but in terms of the new cases. So what we're seeing is the percentage of people who are going into test that test positive is declining. Florida already had a pretty low percentage. Some of these other places throughout the country have been as high as 50%. Some of them are still 30%, 25%. Here, if you look at the last week, the average positivity rate for new individuals was about 7.5%. So that's a good sign that things are going in a good direction. And of course, if you look at the hospitalizations, we are at the lowest number of patients in the ICU statewide today than we have been certainly for the last week. I think probably maybe for the last 10 days. And so you're not seeing people going into the ICU or into the hospitals at the same rate that you had maybe 3 weeks ago. So in terms of flattening the curve, making sure you have enough hospital resources, that's all very, very important. One of the things we've also done, so we have the drive-through testing sites like the one we have in Broward County. We've done 2 in Palm Beach that we've supported with the Florida National Guard, 2 in Miami-Dade, Jacksonville, Orlando, and then we've supported with supplies a number of testing sites throughout the rest of the state. But one of the things we figured out was not every community was accessing the testing in a uniform way. So we created walk-up sites that are mobile, where you can go in particularly to underserved communities and be able to administer tests on a walk-up basis. I mean, not everyone has a car that can go through a drive-through testing site. So we started that in Jacksonville in conjunction with the University of Florida. We've done a couple sites in Broward, Palm Beach. We have Hillsborough, Orange County. We're going to continue to do it. So those walk-up sites just in the last week have done over 4,000 tests, which is very good. The other testing that we've really ramped up is, we know the nursing homes have been the number one place that's been at risk from the beginning. That's why we made sure all the staff were screened, required that, banned the visitors from going in, requiring wearing personal protective equipment. And the state of Florida alone has sent millions of masks just for our long-term care facilities and nursing homes. So we did that. You did have some nursing homes that didn't follow and allowed sick people to come in, and there were negative results from that. You had other situations where an asymptomatic staff member passed the screening, but then spread it to the staff and eventually to some of the residents. So we wanted to figure out a way where you can preempt that. So a couple weeks ago, I created National Guard strike teams to go proactively into nursing homes and assisted living facilities. These are 4-man teams. We now have 50 of these teams operating throughout the state of Florida. They've already done 5,000 tests. I think you're going to see that number increase. But if you see signs of an outbreak, then you can contain it, you can isolate who needs to be. So I think it's a way to protect our most vulnerable residents, and we've been really intend on doing that from the very beginning. Going forward, there's going to continue to be a need on testing. We have contracted with 2 different of these labs that can do high throughput testing. So that's 18,000 samples that we'll be able to submit to these 2 labs a day. We're promised a 24-hour turnaround, but 24 to 48. I've been doing this now long enough that I know when lab tells you 24, sometimes it's not 24, but we think we can get it in a reasonable amount of time. So that will be able to allow us to expand capacity even further. And then I've also ordered the Department of Health to buy high throughput machines for our state labs. We have 3 state labs, Jacksonville, Tampa, Miami, and they do a good job, but they are only processing hundreds of samples a day is their maximum. We want high throughputs so that we can do significant amount in the state labs. That would be, if you're in Southern Florida, we take it every day to the Miami lab, run it through, and then hopefully be able to get a result the next morning. And so those are set to arrive later in the month of May, but we think by the summer we would like to have that set up. So you're looking at 10,000 samples a day just in the state labs in the state of Florida. And also with expanding testing, I ordered the Surgeon General yesterday to allow pharmacies the authority to, if you're a licensed pharmacist, to be able to administer COVID-19 testing. And so we think that could be a convenient way for people to have additional access to testing, particularly as we move forward in dealing with this pathogen. We have now been confirmed that we will have the antibody tests that the state has ordered. There's a company that has them FDA approved. They agreed to sell them to us. They said we're going to have to send to New York first because they've had much worse problems in New York than Florida. But we are going to get the next shipment, and that's due May 1st. If you look at the University of Miami, they were able to do a study, which I think was very important, trying to identify the extent to which people in the population have antibodies, which helps inform us about the risk of hospitalization, the death rate, and really get a true sense of that. So I think it's really, really important. And I'll mention, I'll let Dr. Barsoom talk about it, but they're doing a lot of this plasma therapy. So people that have the antibodies who have already gone through and recovered from the illness, they have an opportunity to donate blood, and then people at the Cleveland Clinic and other places, they can use that for treatment. And we think that there's some positive signs with that. Of course, one of the main reasons why we've done these measures, the mitigation measures and the social distancing, is to flatten the curve, particularly to protect hospital resources. We're right now statewide, the available number of hospital beds is 41% of all beds are available right now. To put that in perspective, that's significantly more availability in both the regular hospital beds and in the ICU beds than we had before the pandemic began statewide. So I think part of it's for the work of places like the Cleveland Clinic, part of it the people of Florida doing the right thing. With the curve flattening, you have availability. We don't have the resources being taxed like you've seen in some other states throughout the state of Florida. I'll remind everyone you can text FL COVID-19 to 888-777. Again, FL COVID-19, 888-777. I wanted to give Dr. Barsoom and his colleagues an opportunity to talk about some of the things that they've done at the Cleveland Clinic, and then when they're done, I may just ask some questions, have a conversation, because he's had some great insights along the way. And, you go back 6 weeks, there were a lot of people in his position that were saying a lot of things. Some of them were just dead wrong on what they were saying, and I think everything Cleveland Clinic, when we would ask how things are going, it was all based on hard data, facts, and rigorous analysis, and that was why we really appreciated getting the counsel for them. So please take it away, and we'd love to hear what you have to say.
Thank you so much, Governor. First, let me thank you for being here, and thank you for your leadership throughout this crisis. I also want to thank Secretary Mayhew from the Department of Health from ACA. I have to say that the work that she's done in helping create a sense of collaboration around all of the hospitals in the state of Florida has been absolutely incredible. In fact, we have daily phone calls with our colleagues throughout Southeast Florida to ensure that we're all aligned in being able to react in case of anything unforeseen or any emergencies. And again, a lot of the credit to that really goes to Secretary Mayhew and to the governor for really creating that culture for all of us. I think that's incredibly important. The second thing that I would say is we are absolutely honored to be able to play the role that we have played here in the state of Florida. It has been an incredible opportunity to see the healthcare system as a whole throughout the state to step up to take care of over 20 million people that live in the state of Florida, and that's truly an honor for all of us. There is no greater honor than when another human being trusts you with their lives or the lives of their family members. We've been able to do some really cutting-edge things here. You heard from the governor a little bit about plasma therapy, and I'm going to, in a few minutes, ask my colleague, Dr. McWilliams, who's the head of our infectious disease department, talk about that. We've also been using the artificial lung, or the ECMO machine, ECMO machine. Those are for patients that are failing ventilators and need another level of care. We've had 3 patients that have been treated with ECMO. 2 have already been taken off of ECMO and have succeeded. We continue to have 1 patient who's still being treated with ECMO, and we have a good hopes in terms of how that will turn out for that patient. So again, that's a truly cutting-edge treatment. Much of what we're doing is based on starting clinical trials to determine the very best way to treat our patients. As you know, we've never treated COVID-19 until now. We're learning things every single day. So every day as we learn more, we're applying that into our clinical practices, and we're spreading the word. So we have 66,000 caregivers around the world that are laser focused right now on ensuring that everything we learn can be used for the betterment of humanity. And I think that's a great message to put out. I also think that you're seeing that from not only the Cleveland Clinic, but other great healthcare systems throughout the state of Florida, again, working together to try to make sure that our patients get the very best care. The last thing that I'll mention was that we did announce earlier this week the Global Center for Evolving Pathogens, which is going to be headquartered right here in our own state up in Port St. Lucie, right across the street from Cleveland, right across the lake from Cleveland Clinic Tradition Hospital in the new Cleveland Clinic Florida Research and Innovation Center, as well as up in our campus up in Cleveland. So we will have investigators from around the country that are coming together now, both here in Florida and up in Ohio, to lead research on not only vaccine development, but treatments around immuno-oncology, using your own antibodies to treat cancers, and really having a better sense of how we can take better and better care of our patients. So with that, I'm going to ask Carla McWilliams to weigh in a bit on the work that's been being done in terms of cutting-edge care for our patients here in Florida.
Thank you, Weston, and once again, thank you, Governor DeSantis, for coming down to see us today. It's really an opportunity, love the opportunity to have you here and for us to speak about some of the things that we've been doing. I have been on the front lines, of course, taking care of many of the patients we have in the hospital with COVID. I've had the privilege to be a part of the team where we are offering artificial lung therapy. As Dr. Weston mentioned, we successfully taken 2 patients off and we still have 1 more patient who is on the artificial lung bypass. For treatment, we have convalescent plasma therapy we are providing to patients. We're also working on several clinical trials in collaboration with our colleagues in Ohio. Some of those clinical trials are directed towards outpatients who are otherwise relevant at home, and some of those clinical trials are targeted towards our inpatient population. Several of them were going to be IRB approved yesterday on our main campus in Cleveland, and we expect to have those trials up and running next week.
Thank you very much, Carla. And then to my left here is Dr. Greg Rosenkrantz. Dr. Rosenkrantz is the president of Cleveland Clinic Indian River Hospital. He came to us after serving as both the dean of the medical school at University of West Virginia, as well as the chair of medicine at the Cleveland Clinic up in Cleveland. Greg, if you can touch on the work that we've been doing in the community throughout the Treasure Coast as well.
Okay. Thank you, Will, and again, thank you, Governor DeSantis, for being here and your leadership during this time. A couple things. It is an honor and a privilege for us to care for our communities, to care for our fellow human beings, to care for the state of Florida, and we'd never forget that. A couple things. The community is part of our core 4 pillars in the best of times, and it's an especially important part now, never more so. And so what are we doing to protect and to serve our communities, not just in the hospital, but beyond the walls of the hospital, in all of our communities? So first and foremost is communication, and it's close communication, daily communication with our local government leaders, with our local health departments, and with our local long-term care facilities to, in fact, protect our most vulnerable and those that are have the potential to have the worst outcomes with COVID. We also have partnered with our first responders across the Treasure Coast to provide care and treatment and comfort to them as necessary. The other partnerships, again, local health departments, etc. We will be available and we will flex our hours as necessary, as we have done already, to serve our communities, to be transparent with our communities with the data and the statistics that are there, and to serve them as the needs may arise. So again, the community is one of our 4 care pillars in the best of times, and it absolutely is a focus today.
Thanks, Greg. Last comment I'll make, just on behalf of my colleagues here, as far as medical professionals go. You know, one thing that I do think is important for everybody to recognize is that it's never happened in any of our lifetimes that we have reversed a viral quarantine. So what we're going to be seeing here over the next several weeks and months will be educational to each of us every single day. I think that there's a lot of excitement about seeing what happens as we move forward, as we start slowly seeing changes with the requirements that we've had put in place. But please recognize that we will learn every day, and we may have to step back from some of those decisions as a society. And also understand that you have to recognize where you sit in terms of your own personal risk. I have my own parents who are 75 and 84 years old, and I've told them that regardless of what happens in the coming weeks, I expect that they will still remain indoors. And when they're outside, they will always have a mask on, they'll wear gloves. As a society, some of the principles that we've learned around social distancing, frequent hand washing, for example, wearing masks when we're out in public, preserving some sense of personal space, these are things that we have to stick with. So recognize that just because you can do something doesn't mean that you should do something. And probably most importantly is if you have any symptoms at all, a cough, GI problems, a sore throat, a fever, it is your social responsibility to your fellow human beings to stay home and to get tested. So even if you have the opportunity to go back to work, if you are sick, you need to say something about that. That it is just too much of a risk to allow our fellow humans to get sick because somebody doesn't want to say something about it. So please take that advice seriously.
Well, great. Can you say a minute, because I was talking with Dr. Barsoom a week or two ago, and I was asking them about, because they're learning things every day, how are you guys treating the folks who may need to be on a ventilator? There was a lot of literature coming out of New York City that once they get on a ventilator, it was like 88% were dying on the ventilator. And so how are you guys handling that? And I think the results here have been better. So can you talk about the experience you've had?
Sure, happy to. And I'll ask Carla as well to weigh in on this. So a couple of the things that we've learned early on from our colleagues around the world, candidly, is that for patients that look like they're going to require intubation, early intubation is likely better than late intubation. That's number one. The second is using lower tidal volumes also seems to do better for the lungs, and prone positioning. So it's not uncommon that somebody would be intubated but actually turned over on their stomach. It actually is easier to ventilate the lungs. There are also some medications that we've used to assist with that, and in patients that don't continue to improve, that's where the ECMO machine or the artificial lung has come in handy for us. Carla, do you want to comment some more on that?
Absolutely. I echo everything Dr. Weston has said. One of the things that's important in our respiratory support for patients is early proning, so the lungs are able actually better. So even for patients who are not yet on a ventilator, but are still requiring high oxygen amounts, we actually ask them to lay down on their stomach and to breathe that way to help improve aeration of the lungs. And in terms of even the plasma therapy, there's been reports in other respiratory viruses that the plasma therapy may be very helpful for patients. It's probably much more helpful to give it early rather than wait. So in other words, give it to someone before they need to be on a ventilator and you know that they are quite ill. And that's one of the strategies that we have employed here. Our success is anecdotal and more clinical trials, more clinical data will come out, but so far it seems to be a strategy for us.
And then what's I think you gave me a number of ventilators, the fatality rate compared to New York. What was your rate?
So right now across the Cleveland Clinic system right now, we have at least a 60% survivorship for patients that have gone on ventilators across our system.
And I think New York's was, 88% were fatalities, or at least some of the numbers that have been very, very high numbers coming out of New York. Can you just talk about kind of the trends you're seeing? I mean, obviously, we were prepared for kind of a peak, and we did see, more people coming. Now we're in kind of a different posture. So do you think, at least locally, that you guys have peaked here?
Yeah, so if you look at our numbers, at one point we had about 42 COVID-19 positive patients in our hospital. Of those that end up in the hospital, about 50% were going to the intensive care unit. And of that 50% going to the intensive care unit, about 2/3 of them were eventually requiring ventilation. Today, we have about 20 patients in the hospital. So we are clearly seeing patients improving and going home and getting back to their lives, which I think is an incredible thing to be confident of. As well, if you look at some of the data across the state, we've seen a significant decrease in the percentage of new patients each day over the course of the last 2 weeks, as well as the number of deaths per day over the course of the last 2 weeks. So when you look at principles of quarantines and reversing quarantines, that's one of the first things that you want to look for, is that over at least a 2-week period, you're seeing a consistent decrease in the number of new cases and the number of deaths each day, and I'm happy to see that we are seeing that.
Can you speak a little bit? I think when this coronavirus first became an issue, I think actually a lot of people in February, I remember, were downplaying it, saying that it was not such a big deal. Then something changed. There was a lot of particularly media attention on it, and I think that people got really, really scared. I mean, it's fear of the unknown. Obviously, when you have a pathogen that there's not a verified treatment for, much less a vaccine, and so I think people have been very, very on edge with this, and more on edge than I would say people were after 9/11 even, or the financial crisis. I mean, it's been a real, I think, a shock, and I think it's caused a lot of people to get scared. And one of the concerns I have, and I think that you guys have seen this, is as the coronavirus has become the all-encompassing issue, you're not seeing as many people come to the hospital with stroke symptoms or heart symptoms. Now, maybe magically people just aren't having heart attacks anymore, strokes, but I think part of that is people don't feel comfortable coming in to the hospital because of fear of coronavirus. So can you speak to some of the fear that's out there and talk to people who may have symptoms of other diseases about, is it a smart thing to not seek medical attention?
Sure. I think that's a great question, Governor. So the first thing I would say is, you're absolutely right. I think the biggest fear is the fear of the unknown. And, here in the United States, and specifically here in Florida, we had some very real advantages over some of our colleagues around the world. We knew that there was a novel virus and that it was likely coming. We knew what that virus was. We had some of the basic statistics around that virus, and we had the opportunity to gear up to be prepared for a potential surge if, in fact, it was going to come. So really, kudos goes out, I think, to all the healthcare professionals throughout the state that were ready to ramp up if we needed it. It's nothing short of monumentous, to be perfectly candid, that we didn't see the big surge that many of us were being prepared for. I think it really speaks to the fact that people took the idea of social distancing and quarantining seriously, that they took it to heart and they stayed away from others, that people got tested when they had symptoms, and that has put us in a much better position today. Unfortunately, it's also put many folks in the position where they feel that going to a hospital when they're not feeling well may not be in their best interest. I want to tell you that every hospital has taken incredible efforts to ensure that our hospitals are as safe as possible. If you look at a study that just came out last week from our colleagues up in Cleveland, they've shown a 38% decrease in patients presenting to the hospital with stroke and heart attack symptoms. Now, the reality of it is, if you're a data-driven person, you would think that the incidence of people having heart attacks and strokes has likely stayed the same. That means 38% fewer patients are seeking care. That's a problem. We need to make sure that people understand that our hospitals are as safe as they can be. We check the temperature of every person that comes into any one of our sites. We have masking in our hospitals for everyone when they're patient-facing or working with other colleagues within a 6-foot area. We test all of our patients before any procedure, and every patient that gets admitted to the hospital is tested. Carla, do you want to just touch a little bit on cohorting, how we make sure that we're not mixing COVID-positive patients and COVID-negative patients? I think that's important.
Yes, absolutely. Thank you, Dr. Weston. As Dr. Weston said, we're very, very concerned about patients that have other conditions not coming in to seek care and the potential downstream consequences of that. And just to reassure the general public, our hospital, along with every other hospital, has gone through great lengths to create what we call cohort units. And what that means is all patients with COVID are put in a particular area of the hospital with dedicated staff. We have environmental cleaning done on a very consistent basis that essentially excludes or removes any risk to any of the other patients who may be on other floors or in other areas. Again, it's not just Cleveland Clinic that's doing this, it's every other hospital in the country, and I think the general public needs to feel safe, and we are able to provide that care. We don't want people who are ill to stay home and not seek medical attention when it's necessary.
Well, thank you. In terms of, you spoke a little bit about going forward, some of the things that will be important. As people start to, and look, this is going to be a slow process, but as people start to transition, what do you think are some of the important things for people to keep in mind just in their daily lives if they're going to work? I mean, I think one thing that's going to be interesting in all this is, we've had a lot of businesses operating. I mean, these quote essential, some of them have gone to 90% telework. And I think what they have found is they could still get an awful lot done doing things like telework, where you're not having density in a workplace, but you're still doing what needs to do. Now, obviously, every employer, depending on what they're doing, just doesn't have the luxury of doing that. But I think you're going to see business practices having gone through this. There's going to be things businesses were doing just 2 months ago that they're never going to go back to. Some of the business travel, they haven't done it now in a month and a half. And if they're not missing a beat, was that really necessary? So I think you're going to see a lot of interesting things in terms of going forward, businesses who went through this process and understood, hey, there's ways that you're able to do it. Now, there's different studies that have come out about the transmissibility of this thing, but I think most of them point to, if you're in a close, sustained contact with someone that's infected, usually in an enclosed environment, that's kind of the most risky situation. So if you're going to 90% telework, you're eliminating that density, and I think that's made a big difference, even for the businesses that continue to operate during this time. But I'll let you guys weigh in.
Yeah, absolutely. These are all excellent points. Whatever can be done remotely in the same way that it would be done in a close proximity probably should stay that way, at least for the very near future. And for those people who do return to the workforce, that social distancing and those rules still need to apply, which is greater than 6 feet, We need to be wearing universal masks as we go back to work, and folks need to understand if you develop symptoms of illness, it is our public duty and our inner right. We have to protect the integrity and the health of those who are around us. People need to know not to go to work ill and to seek testing and medical care when necessary.
Going forward, one of the things that was pretty clear before we really started to see the virus hit the United States was looking at countries like South Korea. And obviously China, you really can't trust their numbers coming out of there. But South Korea is a democracy, and what they were putting out I thought was credible. And if you looked at their numbers in late February, I mean, it was pretty clear that the overwhelming number of fatalities were people, not even just 65 and up, sometimes it was the 70, 75 and up cohort. And so that told us we really needed to do things early for nursing homes, assisted living facilities, but also message to people 65 and up and people that have significant underlying conditions. Avoid crowds, stay home as much as you can. And that was part of our strategy very early. Looking forward at those groups that are higher risk, the elderly and people who are 65 and plus. And obviously we could still have orders in place on them, but just aside from that, what would your advice be to folks who fall in some of the higher risk groups?
Stay home. This virus overall, as everyone knows, the mortality rate is not that high. But out of the people who do develop severe illness, a need for a ventilator, or eventually succumb to the disease and pass away, almost all of them have underlying health conditions or are elderly. And so until we are positive that cases have really gone down and we've gotten ahead of this, the people who are at the greatest risk should continue to stay home and minimize their risk and interaction with others. That is the responsible thing to do for your own health and safety.
One of the things Cleveland Clinic's been great at is, obviously Florida, I mean, we're God's waiting room, we've been called. I mean, we've obviously got a lot of facilities for senior citizens throughout the state. And I knew we had a lot, but until I was surprised at the sheer number. So we have a lot of this, and we focused on it, we put a lot of things in place. But what happens is, if there's an issue at one in a community, you have like Cleveland Clinic, they're on site. They will send people out there. And so it's not just the state. We have healthcare providers doing it, and I think many of them are starting to do it. But Cleveland Clinic has been great really from day one, because it's in their interest to try to reduce an outbreak in a nursing home. I mean, you don't want to have 50 patients coming in here if you can stop it at the front end. So they've been very proactive about that, and I think that that's made a difference. And as we go forward and look at, okay, what's the next phase in terms of doing things like the quote elective procedures, the reason why we stopped the elective procedures was wanted to make sure there was enough hospital beds in case of a surge of COVID patients. Obviously, we've had a lot of capacity throughout this whole thing. Also enough personal protective equipment. They have models about PPE usage that they use. So we want to make sure that the providers have that. But then one of the other things that we're going to ask them to do is, like, if you're going to do this elective procedures again, we want to make sure that you're part of the solution to help safeguard our most vulnerable populations. Cleveland Clinic's already doing it, but we want all the hospital systems throughout the state of Florida to be on board for that as well. I think we can take a few questions. Anyone have any closing comments before we take questions?
I would just say again, I mean, I think that at this point in time, first of all, any loss of human life is tragic, and it's early, obviously, to state that we've won this, that we're victorious. There's still a lot ahead of us where we will learn every day, and obviously we have lost loved ones, we've lost friends, and that is absolutely tragic. That being said, there's a tremendous amount of hope for us moving forward, in that we've learned a lot about this disease. We've learned a lot about transmissibility, and we've also learned that there are mechanisms that we can put in place that slow the spread and potentially halt the spread. That, I think, is a great message to recognize. So moving forward, taking all of these things that we've learned will continue to play a role for us every day moving forward to ensure that we minimize that loss of life, and at the same time recognize that there are other folks that are sitting at home right now with medical problems that need care that we can take care of. So it's clearly a balancing act, and I think it's going to be a process of getting through it and learning about it, but I do believe that we'll be victorious altogether.
Great. All right. Yes.
Governor DeSantis,
Yes.
you said that this week Florida flattened the curve, and I came here hoping to ask you what's your evidence of that. It sounds like you started with some of that. I wanted to ask you if that's the case, and also if Florida was looking to do anything like Pennsylvania, where they're saying that they're not going to lift social distancing until there's fewer than 50 people per 100,000 who test positive.
So, well, I think the evidence. I mean, you look at the hospitalizations. I mean, we have less in the ICU. I mentioned, and then if you look at our testing positive rate, the last 2 days we've had results for almost 37,000 tests, and we have basically 2,000 positives for new Florida cases out of 37,000 tests. So if you compare that to some of these other places in the country where they're at 20%, 25%, that is like 6 or 7% positive, and we've seen that declining there. I think it's important for people to realize we've done more than most states to expand testing in areas that did not have access to, with our walk-up sites, with our National Guard strike teams, our drive-through sites. And so when you test more, you're going to find more cases, but it's at the rate that you're finding, and if that rate is declining, then you're doing a good job. And flattening the curve, there were papers in Florida a month ago saying that by this week, Florida would have 465,000 people hospitalized for COVID-19. And the fact of the matter is, this week, the number of people who've been in the hospital have hovered around 2,100 people, not 465,000. And so the fact that we have huge medical resources available, we have more space in available beds today, more ICU beds available today than before the pandemic began. That flattening the curve is all about making sure that the disease doesn't overwhelm the hospital system. And obviously we did a lot of things to make sure that we were protecting against that. But the fact of the matter is, we have a lot of space. No one thought that we would have this much space. The predictions, just understand, when you say 465,000 people would be hospitalized in the state of Florida, we only have 70,000 beds in the state of Florida statewide. So even if we built some more things, 1,000 beds here, if you have that many people, you're talking about hundreds of thousands of people who would not even be able to be hospitalized. And so when people we're saying that, they're effectively saying we were going to have hundreds of thousands of people die. Because if you don't have the ability to put them in a hospital and they're sick, in excess, other people not with this. So that's where the predictions were. Here's where we are, where we have a lot of space available, and that was the whole purpose of doing mitigation to begin with. Yes, sir.
Governor, you had just mentioned procedures. When do you expect you to get the okay that those prevents MRIs or even some outpatient procedures?
So as I think many of you know, we've had a task force meeting all of this past week about every possible issue moving forward: health, medical system, agriculture, business, you name it. And we had a great, robust discussion with some of the doctors, some of the hospital executives this week about that. Look, as I've said before, if you have enough space that can handle COVID, we hope to not see any uptick, but you could have an outbreak somewhere. And so if that happens, would you be able to handle it? Do you have enough PPE to handle it? Are you going to be proactive like Cleveland Clinic and work with the nursing homes? If you're doing that, and we feel good about that, then we can turn this on. Now, my order, I think, goes to May 8th. So we're going to be looking this weekend about how we're going to do that. But I think certainly we're going to need to do that. elective procedures, I think when people hear that, they think it's like, oh, I'm going to get like some type of cosmetic surgery or something. These elective procedures really do affect patients' health. You're talking about screenings. You're talking about things that are really important. And I understand why this was done, because we didn't know what was coming down the pike. But the fact that we have availability and can accommodate it, I think we do need to move in that direction. So we'll be announcing, I think, pretty shortly. But I do want to review all the task force findings. I obviously want to consult with different people, but I think that's going to have to be done.
Governor, so I have a question about the antibody test, and it's a medical question, so the doctors maybe could jump in too. But are these tests looking specifically for the antibodies that are triggered with the coronavirus, or just any antibody?
Well, I think the Miami one was specific to the coronavirus, but it's a good question, because there are antibody tests that will just tell you if you have antibodies for any coronavirus. So there's a coronavirus that causes the common cold, for example. That does not give us much predictive ability or data that's useful if you're getting what's effectively a false positive. So the FDA-approved test that the state of Florida has ordered will rule out the other coronaviruses and will only let you know if you have the antibody for the current the current coronavirus that causes COVID-19. And that's very, very important. I think Stanford, LA County, University of Miami, these studies we've seen, I think that their test did distinguish between those two things. And obviously if they don't, then there's not a lot of validity to the test. But I think what they showed is, in varying degrees, exponentially more people having the antibodies than have actually tested positive. And it seems like the overwhelming majority of the people that had the antibodies never even had symptoms. And so that's saying that this thing was more widespread than we had thought. It's not even that they weren't getting tested. They had no reason probably to think they needed to get tested at the time. But the larger that denominator of people with the antibodies is, the lower the overall hospitalization rate and the lower the overall fatality rate of the disease. And so the more antibodies that we determine, is that I think it's a good news. Some people say, oh, well, that means there's people that haven't been tested and positive. But I think it's much better news than that, because I think it shows that for the vast majority of people who acquire this, not only are they not going to end up in the hospital, not only are they not going to end up dying, they may not even know that they have it. Now, there's a negative to that, because if you don't know you have it and you can spread it, then it makes it difficult to say, okay, if you're sick, don't go to work, as if that's going to solve it. Because someone may not be sick, and they may be able to. And we've learned now, I think, there's people that go in for COVID who never have a fever. And so I did a fever check coming in. It's a good thing to do, but that's certainly not foolproof to do it. So there's a lot of good things that go into it. I know, what are you guys doing with antibody testing, and did you want to weigh in on the efficacy of that test?
Sure. Right now, we're not offering antibody testing. One of the things that's very important that you pointed out is many of the antibody tests that are available do not distinguish between COVID-19 versus the other 4 coronaviruses that cause the common cold. If you're going to use a test on a mass scale for population-based screening, you need a test that is essentially 99.99999% sensitive, meaning you're going to pick up every single infection that occurred, and you need it to be 99.99999% specific, meaning that you are almost 100% certain if you detect a positive result, you are looking at a true positive, and it is not cross-reacting with those other 4 common coronaviruses. A lot of places are making these antibody tests and doing everything that they can to get them up and running. But right now, at this time, we have not implemented antibody testing for that reason.
Well, we're going to do, one of the reasons you do it is to get a sense of the prevalence of the disease, get a sense of the true lethality of it, but also just in terms of the uses of it for healthcare workers, for example, people that work in nursing homes. If you have the antibodies, you're less risk. And I think there's a debate about, how long does this immunity last for? But clearly, if you have the antibodies, you're going to be less of a risk working with vulnerable populations. So that's a great thing to know. And then even just normal workforce, I think it's a good thing to know. Yes, sir.
Governor, good morning, and thank you for joining us this morning. I know your schedule's busy. I want to commend you on allowing the Cleveland Clinic the opportunity to bring such great information. Very vital, and I'm sure if I got sick, this is where I want to be. I want to let the medical information come out first before my question. And my question is, do you feel you should have been transparent with small businesses in Florida that there was 1,000 or less small business bridge loans available? Thus, you let down 95% of the businesses that applied, which resulted in about 1.
Yeah, no, that's not true. So
it's about 1.6
excuse me.
billion
All right,
dollars, sir.
listen. So what we did
Sir,
was,
with all due respect,
okay, I'm going to answer your question. So stop. So what happened was Congress was doing this PPP. So that was really the best loan program because you get the loan. It's not really a loan. It just gets forgiven. And so they were debating it, but we know how Congress works. So I needed to figure out a way, how could we do some type of short-term thing to get people who were just in dire straits. So we did the $50 million. I announced it at $50 million. I don't know why anyone would think it was anything other than that. That's what it was. And we offered that. Now, that does have to be paid back. It's a very low interest rate. The federal PPP is better. There's just no doubt about it. So the goal is to throw that as a lifeline until we got to the PPP. Now, what happened with the federal PPP is it ran out of money. And they knew it was going to run out of money, and they did this song and dance with it in Congress, and then they finally now have replenished it. There's obviously been hiccups with the program, but our $50 bridge loan was $50 million. Was advertised as 50. We said this is not going to solve every problem. We understood that, but we knew that the PPP was coming down the pike.
Governor, with all due respect,
all right, that's enough.
Very valid, though, if you don't mind.
Yes, sir.
Governor DeSantis, you mentioned that the state has purchased high throughput machines for the Bureau of Public Health labs. According to all the epidemiologists, we're going to need a big infrastructure capable of testing. Is this a path towards that? Are those PCR machines?
Yeah. So these are big high throughput machines. So we have, as I mentioned, we're doing testing anyways in the labs. Now they only do so much. They each do 900 samples a day, which is actually helpful for doing a lot of other things. But when you're talking about mass testing, obviously it's not enough. We send different things. The hospitals have their own labs. Many of them do. So they run tests. You have private labs that have been doing things like Weston and LabCorp. And so that has led us to do 300,000+ tests. I mean, we got in just the last 2 days, as I mentioned, about 37,000 test results just in 2 days. You look, there are states out there who haven't even done 20,000 tests for an entire state. So that's a lot of tests, but we want to be able to expand capacity more. So the contracts right now in place allow us to do 18,000 samples. Now these contracts had just now been signed. We got to establish the process to get the samples there. So that'll be 18,000, and then the high throughput would do an additional 10,000. It's, you hear different things about how many tests are going to be needed or not. I can tell you this: we've run these 7 drive-through sites, either direct support or have the National Guard run them, and we have seen a declining demand to go in. When they first came, there was a certain amount, and then it has kind of gone down, even as the criteria was expanded. Initially, when the test strips or the collection swabs were in such demand, we couldn't guarantee that we could test every single person with symptoms because we had to focus on the people that were most at risk, the 65 and up. But then as we went through that, as the demand waned, we expanded the testing criteria. So now, if you're 30 and you have coronavirus symptoms, you can go through these sites. And I think that's good. So having this additional capacity is important. But these sites do have more capacity right now, and I view that actually as a good thing, because you look at a place like Duval County. We've had the site there at the football stadium for a long time now, and we was 65 and plus with symptoms or underlying condition, healthcare workers, first responders. They didn't have enough people going through, so then they expanded the criteria. And look, if there's not demand for it, that may mean that there's not a lot of symptoms running around the community. So we viewed that as a good sign.
Governor, just one more
yes, sir.
What about
see a scenario where, the northern part might be up and running and how many weeks behind are we down here in South Florida?
Well, we're working, we've worked with Southeast Florida differently from the beginning. I mean, we recognize the outbreak was different. You can see the number of cases linked to travel from New York City, for example. This is where people from New York City go, this part of Florida. So that was obviously an issue from the beginning. There were different things done in South Florida earlier that were not appropriate in other parts of the state at the time. And so I think you continue to view it. You look at right now, we still have 60% of the cases emanate from 3 counties in South Florida. They're 29% of the population, but yet 60% of the cases. I think over 60% of the fatalities, and I think over 60% of the hospitalizations. And so, of course, you keep that in mind. At the same time, you look at that phase 1 that the president has laid out. It's not terribly different from what we're doing now. I mean, it's not like there's not going to be a huge change in phase 1 if you look. Some of the things that they have on there, like, social distancing at like a sports arena, we're not doing in-person sports yet, no matter what. I mean, that's just not going to happen in May. I've been very vocal about trying to get UFC we have coming, WWE, Tiger Woods, and Mickelson, but that's all under the understanding. That's for TV, so people have some content. Obviously, those are, having relationships with those entities. I'd like them to come do big events here when the time is right, but that's going to be far in the future. So you're not going to do that. Another thing in phase 1, they say movie theaters with social distance. I'm not there yet on the movie theaters. I think it's an enclosed environment. You're much better off being outdoors than in an enclosed environment for this. That's just the reality. We don't have evidence of major outbreaks from outdoor. Doesn't mean it can't happen. Of course it could. If you had a big concert, everyone was piled in. But if you're going out for a run or doing that, whereas if you're in an enclosed space for a couple hours, it's just a little different. So I'm not that keen on that. They talk about elective surgeries. Obviously, we're moving in that direction. They talk about keeping the bars closed. We're going to keep the bars closed. So there's not a huge leap for phase 1, even in South Florida, I think. But of course, we're going to be consulting, and we're going to do it all based on data, kind of where trends are. I have talked to Dr. Barsoom, though, about some of these things. When you have restrictions, that can produce density in certain places. So, for example, we've seen images of people like piling into Costco or some of these other places. You have a better chance of catching coronavirus, most likely, at a supermarket than you do walking your dog outside. And so if you look at something like a restaurant, if you had limited seating outdoors, would that reduce some of the density from the supermarkets? It may or may not. These are things that we're thinking about. But I would say phase 1 is a very, very small step forward. And I think the prudent way to do it is to be very methodical about this, be very data-driven. I'm not in a rush, to do anything. I would rather do it right. And as Dr. Barsoom said, this is unprecedented in modern American history. Even the Spanish flu, they didn't do this. They did school closures, they staggered workplaces, they stopped big events. They didn't have a nationwide effective quasi shutdown like we've had in this country. So people, we don't really know what's going to happen going forward. But I think being judicious, I think really focusing on safety, and making sure that what we're doing is based on the facts and that we're constantly evaluating. And it may be the situation where some part of the state or even a community there's an issue, and then you can make decisions to try to deal with that. But people should just know that we're in uncharted waters here. Nobody knows really what's specifically been effective or not, and no one knows what's going to be effective or not going forward. We think we may know certain things, but you got to be willing to constantly reevaluate everything that's going on. Okay?
Well, how big they are, because I haven't seen pictures or been there yet, but there are some protests, I think, this weekend, the reopened Florida ones. Your perspective on those?
I haven't seen very much on that. I think that people who want to see Florida go, I think a lot of them appreciate that I've been very measured on this. I've treated different parts of the state differently. What we're trying to do, and what we've tried to do, is to reduce the type of contacts that would lead to the transmission of the virus. But what that means is you don't arrest somebody for planting seeds in their yard. You don't, when they had them drive-in church service in one state, people didn't even leave their cars and they were getting tickets for that. That's unacceptable. You know, we're doing this in a way, I think, that trusts people, that understand people should be treated with respect. And so I think you haven't seen the type of backlash here that you've seen in some of these other states. Because think about it. What right does government have to restrict you if it has no relationship at all to fighting an infectious disease? And some of this stuff that's been done, I think, has no real relationship to doing it. And so anything I've done, I think the folks locally here in Broward and Dade, when they've had to do things, I think they've focused on, okay, how do you, what can you do that would limit the spread of the virus? But beyond that, we don't really have, I don't think, legitimate authority to be doing it. And so I think some of these places that really got carried away, I think it spawned a backlash. And I think in Florida, I think people, it's been tough. It's been real tough. I mean, you talk about kids being out of school for working parents. You talk about people losing jobs like we've never seen before in this country or in this state. This has been very, very difficult for a lot of people. And of course, someone you know may end up contracting this virus. You know, most people have recovered, most people have been fine, but people have ended up in hospital. They've had brutal illnesses, even if they end up recovering. Obviously, we've had people pass away, not at near the rate in some of these other states or what the rate was predicted for Florida, but it's tough, and it's very tough to deal with all this stuff. So I think all those things considered, I think the people of Florida have done a great job. I don't think that you're going to see the type of the type of complaints that you've seen in those other states, because I think we've approached it the right way. I want to thank the Cleveland Clinic again for their leadership, for saving lives, because they have definitely saved lives here in the state of Florida with their excellent medical staff. It's a very well-run facility. They thought very deeply about this virus from the beginning. They relied on really hard data and facts, and I just commend them for their efforts. It's been an honor to be able to work with you guys, so thank you.
Thank you very much.
All right.